participation certificate. All of you who are here, please don't forget to download it. As you can see on the screen, we have a picture of a guest, CEO and founder, Dr. Akram Ahmad. Who are we? What is Academically? We are basically an edtech headquartered in Australia, aimed at helping healthcare professionals excel in their lives and careers. It was established by Dr. Akram, who is himself an educationist and a visionary, who, with an exceptional vision, founded this institute 3 years back. Dr. Akram Ahmad himself is a clinical pharmacist with a distinguished career of 15 years, with vast experience of teaching and research in India, Malaysia, and Australia. A little bit about myself once again. I'm an academic head here with Academically. Myself done my MBBS MD from Christian Medical College and Hospital, Ludhiana. I qualified my USMLE 10 years back, but I stayed back in India and now I'm here interacting with you, hoping to help you all clear this AMC pathway. A little bit about our faculty. We have our faculties Dr. Swapnil, Dr. Udara, Dr. Priyanka, Dr. Sabina, Dr. Zahra, Dr. Amit, Dr. Bhavya, who's here with us today for this masterclass, and Dr. Naeem. Now, I would like to stop sharing my screen, and Dr. Bhavya, if you could please take over and continue with today's masterclass.
Hi all. Is everything fine? I mean, I just want to know if technically, like, my video is fine, my audio is fine. Can I just get a quick thumbs up?
Yes, Dr. Bhavya.
Okay. Okay. Perfect. So, hi all. I have no idea how many of you actually want to be pediatricians here, but let me tell you, it's a beautiful subject. So, firstly, let me introduce myself. So, I'm Dr. Bhavya. I have done my MBBS from Osmania Medical College, Hyderabad. Then, subsequently, I followed it up with an MD Pediatrics from Osmania Medical College, Hyderabad. In the meanwhile, even I have given my USMLE exams. I have passed USMLE Step 1, Step 2, and I am ECFMG certified as well. But then the COVID hit, and I decided I need to stay back here. I do not want to move to the US. So that's when I just, again, quickly took a U-turn and stayed back here. So, we pretty much all of us are, we were at some point wanting to be global doctors, but for our reasons, we stayed back. And today, we want to hold your hand and help you people in this journey of wanting to be global doctors, right? So that was a brief introduction about myself, guys. So today, whatever session that I'll be taking. So first of all, I have no idea how many of you want to be pediatricians, but I'm sure most of us might have accompanied at least some cousin of ours to a pediatrician, right? So it could be some person going for cold cough, some person going for some abdominal pain, or whatever reason it could be. Guys, can you tell me what are two things every pediatrician will check, irrespective of what you do? Like, you went for a cold cough complaint, you went for an abdominal pain complaint, you went for a urinary tract infection, whatever could be the complaint. But every pediatrician, if you see, there will be two charts attached into the file, irrespective of whatever complaint you went. Anyone? Can anyone just take these quick? Perfect. So weight and height, what are those things? What are those charts called, guys? What are those charts that they're called? So the two things, guys, any child for whatever complaint you go to a pediatrician, two things that they will definitely always monitor for. One is anthropometry, excellent, guys. So it would be height, weight, and your head circumference, which is usually given as a growth chart, right? And the other thing that a pediatrician will always check for would be what is the immunization status. Is it the problem with everyone, guys? Is my voice not clear with everyone? Okay. I get a thumbs up, so I'm assuming it's a problem on your end. So let's just continue. Okay, perfect, guys. So let's just continue with what I was speaking. So what I was telling was that the two things which every pediatrician monitors every child is anthropometry And the second thing is the vaccination status of the child, right? So very briefly today, I do not, this will be just a glimpse into how we'll approach the sessions, how we'll approach a topic, and how we'll correlate it with our day-to-day activity as well. It's not just that you're learning medicine for the sake of cracking an exam, right? It needs to help you to become a better doctor on a global level as well. So let's just begin, guys. So I see a lot of people mentioning, just a minute. So I have seen a lot of people mentioning about anthropometry, right? The two terms that I had seen, one was anthropometry, and the second term that I had seen was you guys mentioned about growth charts. So very quickly, anthropometry, usually what we check is height, weight, and head circumference, right, guys? Growth charts. Now, can anybody very quickly tell me what idea do you have of a growth chart? What exactly is this growth chart that we have been talking all along? Anybody? What are the different types of growth charts that you have? Or, what exactly do you understand by the concept of a growth chart? Yeah? You can just type in very shortly, like whatever you feel like sharing. So, what is the whole purpose of having this growth chart with you? According to the age, the height, weight is used to calculate the BMI. Okay. Perfect, guys. So I am assuming that most of you have a brief idea about what a growth chart is. So basically, a lot of research was done earlier, and based on based on the age of the child, taking into the social socio-economic and whatever conditions, taking into the ancestral demographic data, you're comparing what is the height, what is the weight, and what is the head circumference, and what is the BMI of that child at their respective age, right? So you have multiple types of growth charts, guys. Very quickly, I'll tell you a couple of growth charts that we usually follow. So there are, for 0 to 2 years, we follow a different chart, and greater than 2 years, we follow a different chart, right? So for 0 to 2 years, you have WHO charts. These are usually, universal charts. Okay. And then greater than 2 years, we follow what is called as the CDC charts. These are the charts which have been prepared based on US demographic data. Fine. And you can also have NIH charts. And in India, we have something called as the IAP growth charts, right? But in Australia, what we follow is 0 to 2 years. You'll follow the WHO or the universal growth charts. And for greater than 2 years, you have something called as the CDC charts. Guys, each session is just for a brief idea for you to understand how you'll be taught, like, in this process of, appearing for your AMC exams or whatever exams that you want to take. This session is just a, quick, a glimpse of what you can expect from our sessions, right? From our classes. Okay. I'll just take a very brief 20 to 30 minutes. That's it. And then again, we'll get back to your, the pathways and all the other topics, right? So coming back to the growth charts, guys. So very quickly, so when you have 0 to 2 years, guys, this is called as length. Okay. And then after 2 years, you call it as height. Fine. This is something which not a lot of people are aware of. So whenever you have 0 to 2 years, you call it as length. And whenever your child is greater than 2 years, you call it as height. So very quickly, if you can see on my y-axis and on my x-axis, right? So this is the x-axis where you have an age, and on the y-axis, you're having length, because per se, we are dealing with 0 to 2 years, right? So very quickly, can anybody tell me what are these things you see here, guys? What is this 3rd, 15th, 50th, 85th, 97th? Anyone? What is this exactly called? Centiles, right? So most of us, very good. So I see a standard deviation as well. So whenever you're comparing general populations, guys, you use two metrics, right? So first thing you use is percentile, or you can use it with standard deviation. I'm sure most of us know percentiles, right? You give exams and then suddenly there is some random percentile associated with your rank. It's trauma, but then I'm pretty much sure we know what exactly do centiles and standard deviations mean. It means that where do you stand with respect to the corresponding population, right? That is what it means. Even when you give an exam, you get a mark, you get a percentile. It means that out of all the people who gave the exam, at what position, you're comparing it with your other people who ever have given that exam. So at what position do you stand? So similarly, it's the same, guys. So whenever, for example, now tell me, you guys tell me, I have a 1 year, 2 months old child. Okay. I have 1 year, 2 months old child who has come, and now I've measured the anthropometry and I have gotten it to be 62 centimeters. Okay. So I have 1 year, 2 months. I'm plotting the graph for you. It will be somewhere here, right? So you have 64 centimeters. What is the inference here, guys? What is the inference that you want to draw here? Can anybody tell me what is the inference that you want to draw here? Anyone? What is the inference that you want to draw here? Yeah. So let me repeat my question. I have a 1 year, 2 month old child, and there is his height is 62 centimeters. Okay, Dr. Sandhya, you're right. It is short stature. Why do you call so? What is the definition of short stature, guys? Okay, yes, I'm coming to here. Like, what do you label it as short stature, or do you want to go ahead? So, first and the foremost thing, short stature, right? You will label it as short stature when the length or the height is less than third centile, guys, right? Less than third centile or less than three standard deviations. That is when you're going to call it a short stature. Because we're dealing with centiles, because you have less than third centile, this person is a case of short stature. Now I'll use two more terms. Very commonly they use two more terms. What is it? One thing is called as stunting. The other thing is called as wasting. So can anybody define these terms for me? Does anybody know what do they indicate, and can anybody define these terms for me, guys? What does stunting mean? What does wasting mean? Have you ever heard of these terms? Yeah, anyone? So whenever stunting means stoppage, okay, fine. I'll give you a better termination. You're trying, I appreciate it. But what do you mean by stunting and what do you mean by wasting? So stunting means when height for age is less than third centile. Okay, perfect, Dr. Anjana. So the better terminology here would be when height for age is less than sorry, this is stunting, guys, not wasting. So stunting is height for age less than third centile, whereas you will label a child to be that of wasting when weight for height is less than third centile. Perfect, perfect, guys, perfect, perfect, perfect. Perfect. So now can you also tell me this is a case of short stature as well as what? Is this a case of stunting or is this a case of wasting, guys? Where height for age is less than third centile. What do you want to label this child also as? Yes, perfect. Stunting. Perfect, perfect, guys. Perfect, perfect. So now I'll again come back to you guys. We'll discuss short stature a little more in detail. So now again, I'll give you another child. I'll give you another child. Okay. Let's just say I have a 1 year, 10-month-old child, and now my child is 90 centimeters. Okay. So 1 year, 10 months, I am going up and I have the child somewhere here. Now, what do you want to do in this child? What do you want to do here? What do you want to call, what do you want to label him as? What do you want to categorize this child as? Yeah, perfect, perfect. So it is between 85th to 97th centile, right? Which means that this person is having appropriate, right? This person is having appropriate growth for his age, right? Perfect, guys. And one more thing, guys. I'll just ask you one trick question. Now you have labeled this child as short stature. What do you want to do next? How do you want to evaluate this child? Is there something else that you also want to do, or how do you want to go about it? You see people who have what you say, you come across these terms, right? Something called as familial short stature, something called as constitutional delay, or maybe is this a case of growth hormone deficiency which is causing short stature? How do you want to go about these things? Perfect, perfect, perfect. Excellent, guys. I like how you people are thinking. Before you actually label this child, before you actually, call this as a short stature, you will definitely rule out physiological causes of short stature, right? What could be the physiological causes? It could be constitutional growth delay. You can have constitutional growth delay, as well as there is something called as familial short stature, right? For familial short stature, you will check mid-parental height, and based on that, if even the mid-parental height is also low, probably you're dealing with a case of familial short stature, right? Another cause also could be constitutional growth delay, wherein initially the child is having short stature, like in this child, where in 1 year, 2 months, you actually have short stature, but eventually when the pubertal spurt hits, right? When the pubertal spurt hits, he will attain normal centiles. So this is why more so important, you should continue growth monitoring, right? It's not just one time visit, it's not just one time thing. So now tell me, the same child, okay? The same child, when you have 1 year, 2 months, the child is less than third centile, okay? I have put this child on monitoring. And then now my child is 15 years and his height has reached 50th to 85th centile, right? So what does this mean? This case could just simply have been a case of constitutional growth delay. So I just wanted to highlight one important point here is before you label a child with short stature, it is very important for us to follow him up, right? You follow him up and you see how his height is growing. Is the height, the height could improve like this, then improve like this, and then eventually be like this, right? So this is also a potential possibility, right? So it is very important for us to follow the child up even sequentially to see how the growth velocity is, right? And whenever you are suspecting stunting, it is very important to also take nutritional history, right? Even nutritional causes can cause short stature. This was very short of how do you approach a short stature case and what is the importance of growth charts here. So let me repeat again, less than third centile, you're calling it as short stature. Greater than 97 centile, you're calling it as growth acceleration, right? And you also want to be careful before labeling it as short stature by ruling out two things, which is familial short stature and the other thing being constitutional growth delay. That was about the length, guys. Very quickly, head circumference. So can anybody tell me why is head circumference important? Why is head circumference important, guys? Yeah. So very quickly, what are the definitions? If you have less than third centile, you call it as what, guys? What do you call it? If head circumference, again, we are following the same thing. Third centile, 15th centile, 50th, 85th, 90th. So I have a child. Let's just again plot it here only. You have a 3-year-old child whose head circumference is 42 centimeters, right? So I have a 3-year-old child. I go up, I have 42 centimeters. So this is coming what? It is less than third centile. So I will label this child as microcephaly. Excellent, guys. Excellent. On the other hand, I have a 1-year-old child. Okay, I have a 1-year-old child whose head circumference is 53 centimeters, guys. So I have a 1-year-old. This is case A that I just discussed. Then we're talking about case B, right? So case B, 1-year-old who is 53 centimeters here. So now this head circumference is what? It is actually greater than the 97 centile. So what is case B now? As somebody has rightly mentioned, this is a case of macrocephaly. Now, very quickly, you people will tell me what are all the differential diagnosis for microcephaly first, and then we'll top it up with macrocephaly. So now I've used my growth charts. I have confirmed I'm dealing with a case of microcephaly. What all? Microcephaly, guys. First, we'll talk about microcephaly. So what all things could be the causative features? Excellent, excellent. Down syndrome. Very quickly, can anybody tell me what is the chromosome involved in Down syndrome, guys? What is the chromosome? What is it? What is the genetic abnormality that you see in, yeah, 20, is it 23rd? Anyone? Perfect, perfect. Don't get confused. It is trisomy of 21st chromosome, right? So excellent. So first thing, whenever you have microcephaly, you're thinking of genetic syndromes, right? So very rightly said, Downs, Edwards, and Patau. All three are trisomies which can present you with microcephaly. Excellent, guys. Anything else apart from genetic disorders that you can think of which can cause microcephaly? Microviral infections. Okay, very quickly, what are those intrauterine infections, IUIs, that can cause microcephaly? Fetal alcohol syndrome. Excellent, excellent. Fetal alcohol syndrome. Torch. Anything else? Can you think of any other? Perfect, perfect, guys. Congenital Zika virus. Excellent, excellent. Excellent. Excellent, excellent. So yes, this pretty much sums up. Somebody was telling about IUGR babies. Yes, IUGR babies also will have what you say, microcephaly, and you use other charts for it. Can anybody? I'm being a little cheeky here because I'm a pediatrician. I know this answer. I'm not expecting you guys to know, but can anybody very quickly, because we're discussing charts, can anybody tell me what are those charts that you use for IUGR babies? It is okay if you don't know. It is slightly more depth question. Anybody? Can anybody? Brownie points for anybody who knows this. I'm sure we have all read it at an undergraduate level as well. Just the name of the charts that you use for IUGR babies. Excellent, 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 Sandhya. It is Fenton's chart. Excellent, excellent chart. Okay, perfect. So these were the causes of microcephaly that you have to think of in terms of a baby who's presenting to you with head circumference less than third centile. Very quickly, if you have a child who's presenting to you with macrocephaly, then what are all the causes, guys? What are all the causes of macrocephaly? Diabetes, okay. I wouldn't say macrocephaly. You will have a large for weight baby. Excellent, excellent, guys. I see hydrocephalus here. Brain tumors, yeah. But brain tumors is like, okay, fragile X syndrome. Can anybody tell me one syndrome where you have overgrowth of the entire body, guys? Like overgrowth of the entire body, including your head. What is that syndrome? Can anybody tell me that syndrome? It is also known as an overgrowth syndrome. It starts with the letter S. Beckwith-Wiedemann is hemihypertrophy. It's not complete total hypertrophy. It is hemihypertrophy. You will have increased risk of Wilms tumor. Sturge-Weber is a neurocutaneous syndrome, which is what is Sturge-Weber? It is a no, not Prader-Willi. Overgrowth of everything, guys. It's not just the head, the entire body. You have large height for age, you will have large weight for age, you will have larger head circumference for age, and it starts with the letter S. Anybody? Brownie points for whoever gets this. Anybody? Perfect, perfect, Dr. Seth. It is right. That is Soto syndrome, guys. Soto syndrome. Excellent, excellent, excellent. Perfect, perfect. You got the exact specific thing that I was looking for, right? So these are all the causes of macrocephaly. So this is again what you have to do. Very important is see we have discussed overview, right? But now let me tell you, if I have a meningitis baby, right? One dreaded complication of meningitis is what, guys? What is that one dreaded complication of meningitis which you want to be very careful about? Is hydrocephalus, right? So now how do these growth charts help me out? So every time you have a meningitis, guys, you will actually monitor for head circumference, right? So for example, now I have a baby who is 2 months old who is having meningitis, and this is the head circumference. Then again after 5 weeks, this is the head circumference. Then again after 5 months, this is the head circumference. What does this mean? This means that the head circumference is normal, right? The whatever the head circumference it is increasing at a normal rate. But I have the same meningitis child. But again, on recurrent, follow up, this is what I see. I see rapid increase in the head circumference. Even without, even without imaging, you can tell that probably this child has developed hydrocephalus as a complication of meningitis. So this is why head circumference becomes very important, right? So can anybody tell me some congenital anomalies where you can have macrocephaly, guys? Some congenital anomalies. You read in radiology all these fancy terms, no? Box cut appearance. What can anybody tell very quickly those congenital anomalies where you have macrocephaly? Anyone? Yeah. Anyone? It's a slightly difficult question, but Arnold carry, okay. I'll give it to you. Arnold carry. Anything else? Anything else that you want to think of? Okay, gigantism. Okay. So guys, a lot of syndromic features, if you have read about Leeson-Cephaly, or all the other syndromes, you have mucopolysaccharidosis, Tay-Sachs. Excellent, guys. So all these are what? These are all your liposaccharide deposition in the brain, right? This also causes macrocephaly, fine. So this is why it is important for us to monitor head circumference. So we've discussed about height and length, we've discussed about head circumference, and what is the inference in each of the case, right? We've discussed about how do you want, what is the inference that you have. Now very quickly, if you see on this Here you have three. You don't have, unlike the other things that we had, third, 15th, 50th, 85th, and 97th. Here you don't have this. Here what you rather have is 0, 2, 3. This is nothing but standard deviation, right? So again, this you either you're using percentile or you're using standard deviation. Whatever you use, guys, the whole purpose of using a parameter, a metric like this, is to compare it with the general population, right? So now I'll tell you two things. You have weight for age and then you have weight for height. Okay, very quickly, if weight for age is less than three standard deviations, what do you call? And if weight for height is less than three standard deviations, what do you call? What do you want to label? So let's just take this chart only. So you have weight of the boys here. So if you have weight for age, for example, you have a 3-year-old whose weight is 8 kgs, right? So this is a 3-year-old whose weight is 8 kgs, which means here it is less than third standard deviation. This is what weight for age being less than third standard deviation. What do you want to call it here? What do you want to call this child here? Malnourished. Can you be more specific? What exactly do you call? You're right, Dr. Pratiksha. Can you be more specific? Okay, wait for age. We've already discussed. So a lot of people are telling me, ma'am, it's wasting. Given, it's wasting. Done, guys. What is this that you call? Weight for age is less than standard. It's not called, Dr. Here, weight for height is not stunting. Height for age is stunting. Okay, height for age is stunting. Weight for age is what, guys? This is something I'm sure a lot of you have, in your hospitals also you have a specific ward for these kind of babies. What is it called, guys? Can anybody elaborate what is SAM for me? What is SAM? What is SAM? Anybody? Can anybody elaborate? You call it as severe acute malnutrition, right? So I'll just tell you all the definitions at one place here, right? So first we discussed was when the height for age is less than third centile. You will call it as what, guys? What is height for age less than third centile? What was the first thing that we discussed? When height for age is less than third centile, what is it called? Perfect, perfect. You call it as stunting. And weight for age is less than third centile. What do you want to call it? No, weight for age, guys. Weight for age. Height for age. Perfect, 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 guys. It's SAM. And when your weight for height is less than third centile, then what are you calling it as? Wasting. Excellent. So now, from now on, in nutrition, you are never getting these definitions wrong. I'll repeat myself again. Height for age less than third centile is stunting. Weight for age less than third centile is SAM. And weight for height less than third centile is wasting. Fine. You're never getting these definitions or you're not marking these answers wrong. Perfect. So all your, whatever definitions could be confusing you or whatever, they're all at one place. Just go through these ones. Okay. So this was about our growth charts, guys. Now I want you to just observe two things, okay? So this is length for age of a boy's chart, and then this is length for age of a girl's chart. Can anybody tell me what has changed? Like just looking at this, what has changed? There is one chart here, and then there is the same length for age chart of the boys here. What is that one difference you can just pick up at the go? Let me see how many of you all are colorblind now. So I've given colorblind and suddenly the answer pops, it's the color, right? So whenever you have a boy's chart and whenever you have a girl's chart, the major way to pick it up is that the boy's chart will be blue in color, whereas the girl's chart, if you can appreciate, it is pink in color, okay? And obviously, where the heights fall, the different centiles will be different for boys and girls. It's based on the demographic data, previous demographic data, which is age specific as well as gender specific, right? So I'm not going to go through all of this again. Okay, I'm not going to go through the definitions stand the same whether it's for the boys or the girls. It's just that based on the demographic data, which is gender based, your centiles will keep changing here and there. So which is 97 centile for a boy might be 50th centile for a girl. So I hope you're understanding the point. They will be gender specific as well, your growth charts. Fine. So the same height for a girl and the same height for a boy will fall at a different centile. That's the only point I want to make here. Okay. So excellent. Let's just go ahead. So again, these are the CDC charts, guys. So whatever we've discussed, these were the WHO charts that I mentioned, which you usually use for 0 to 2 years. Okay. Then After 2 years, you're using something called as the CDC charts. Okay. Again, the pink one is for the girls, whereas the blue one is for the boys. Fine. Again, this is a pretty much, I think most of you might have seen these sort of growth charts in every baby's, what you say, admission chart. So this is important because you will do serial monitoring and you can pick up, all the other things which we had discussed initially, like familial short stature, constitutional growth delay. All of these things can be picked up upon serial monitoring, right? So that was about growth charts, guys. Anybody at this point wants to ask any questions related to this? Yeah. Before we just move on to the immunization, anything that you want to ask at this point regarding growth charts, guys? Growth charts or the definitions that we've discussed, the causes that we've discussed. Anyone? Yeah. Any questions so far? Okay. So perfectly understood. Okay. 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 So can I ask you a trick question here? Let's see how many people. Okay, I think we don't have so much time, but yeah, assuming that you've understood all the growth charts and everything here, we'll move ahead with the immunization schedule, guys. So before the session began, we were just having a brief discussion about the Indian immunization schedule. I'm pretty much sure that everybody knows Indian immunization schedule. Now, I want to ask you guys a trick question. This is what I face in the OPD also most days, right? So I am practicing in India, and I'm assuming most of you guys are India based. So I'll just put this question across to you. This is based on the national immunization schedule, guys. So the most common question which these people will come with is, you have a 3-year-old female child and the mother says, my baby was sick all throughout, I have just given her birth dose, and then this baby was sick every time fever, cold, cough. So we have missed all sort of vaccinations. My child has not been vaccinated at all. And now suddenly at 3 years of age, the mother says, for my child. What will you write, guys? What will you write? First of all, what is this called as? This is called as something called catch-up vaccination, right? Wherein you're planning the vaccination program. You're planning for vaccinating an unvaccinated child or a partially vaccinated child. So this is catch-up vaccination. Now, very quickly, I want you guys to think about this and tell me, 3-year-old female child, only birth dose given. Can anybody tell me, according to the national immunization schedule, you have an unimmunized child? Okay, it's an unimmunized child. At 3 years, the child shows up and she's like, what vaccines can I give for my baby? I've not taken anything. What do you want to do? What vaccines will you ask her to give? Anybody? This is very important, guys. This is what you will face, on a day-to-day basis. This is something very, very important, which a lot of people come across. Yeah. Anybody wants to go? So Sandhya says DPT, HPV, OPV, or IPV. I saw Hib B, and I think I saw a pneumococcal. Anybody? Anybody with different answers, guys? Yeah. Anybody with different answers? So these are a lot of vaccines that we have mentioned. Okay. So see, this is where the confusion arises, right? So a lot of people are actually telling me, measles, OPV. Okay, guys. Okay. So I will just very quickly, if you have an unimmunized child, guys, this is very important. This is a very universal problem. This is an unimmunized child to you in India. I'm telling you the Indian guidelines first, and then we'll move on to the Australian guidelines. Fine. So in India, how do you approach this child based on national immunization schedule, right? So what we actually see is whether the child is less than 7 years, less than or equal to 7 years, or whether the child is greater than 7 years. Okay. So at which is your zero visit, you have 1 month, you have 2 months, and then you have 6 months. Okay. So at zero visit, what you give? Can anybody tell me what are the birth dose vaccines that you give, guys? What is the birth dose vaccine? I'm just giving you a hint or a shortcut to remember how you want to remember. Can anybody tell me what are the birth dose vaccines that you give? Anyone? OPV, I see OPV, I see BCG, and okay, I see a lot, and Hep B. Excellent, guys. So these are the birth dose vaccines that you give. Very quickly, can anybody tell me what are the routes and how do you want to give this? Very quickly, how do you give OPV, guys? How do you want to give OPV? Oral, excellent. How do you want to give BCG? How do you want to give BCG? Where exactly do you give BCG? Where do you look for that BCG scar? Guys, I see a lot of IM. Please, huh? It's intradermal. Don't ever get this wrong. Is it right arm? Is it left arm, guys? Yes, it is deltoid. It is left. Excellent, excellent. So you will give intradermal in the left upper arm. Excellent, 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 guys. And what about Hep B? What about Hep B? What about Hep B? IM, excellent. And where do you want to give? Anterolateral, right. Excellent, guys. Excellent, 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 guys. Excellent, excellent. Perfect, guys. So these are your birth doses, right? So even if you have an unimmunized child who is coming to you, you will give those birth doses. You will give all three birth doses, which is OPV, you're giving BCG, you're giving Hep B. Along with this, you will also give DTaP or DTWP, right? Can anybody tell me what is the difference? I have written, like, basically you have to give DPT for this child. Okay, along with the vaccines that you give at birth. Let me repeat, I'm telling you immunization of an unimmunized child, which is also called as catch-up vaccination according to national immunization schedule, right? So first you will give the birth doses, all the three vaccines that you give at birth, which is OPV, which is BCG, and you're giving Hep B. Along with that, you will also give DTP. Now, my next question is, what is this thing that I've written, AP and WP? Very quickly, can anybody tell me what is the difference and why was it introduced? Why was the cellular component of pertussis introduced? First of all, what is DTP, guys? What is DTP? What are you vaccinating against? What does D stand for? Perfect. A and W, I've gotten the full forms. A stands for acellular, whereas W stands for whole cell. Perfect. Perfect. Perfect, guys. So D is diphtheria, T is tetanus, P is pertussis. Perfect, perfect. Okay, guys. Okay. So I have gotten an answer where you have mentioned acellular has less side effects, whereas whole cell has more side effects. Can you be more specific, guys? What is that one side effect which was actually very common with whole pertussis vaccine? Hence, it led to the introduction of a acellular vaccine. What was that one dreaded complication of pertussis, guys? Crying? No, yeah. Every baby cries. Yeah, yeah. So it is convulsions, actually seizures, right? You have, there was a very increased risk of seizures following the whole component of pertussis. So that is why you have introduced acellular pertussis. This is at the 0th visit. So the answer here, I have written the answer which was given by one of you. Please cross check. So what is the answer that you want to give? What is that thing that you want to give to an unimmunized child at the first visit is OPV, BCG, Hep B, and DTP. Fine. Then following 1 month, you will give OPV, you will give DPT, and you will give Hep B. Okay, BCG is done. Even in your normal national immunization schedule also, you only give BCG at birth, right? So even at 1 month, after 1 month, you ask them to come, you give everything apart from, and doctor, I am talking about catch-up vaccination. I am not talking about, partially immunized or what is the normal immunization schedule. What were all the missed doses of the vaccine which the child should have taken by now, and now what you want to give, right? There are two different things that we're talking about. Fine. Then coming to after 2 months, right? This is after 1 month. This is after 2 months. So after 2 months, what you give is oral polio, you will give measles, and you will give typhoid vaccine. Okay. And then after 6 months, you will give DTP and you will give Hep B. Already said, no, then I again corrected myself. I've said unimmunized child. Okay. It is unimmunized child, guys. What we're talking about is catch-up vaccination in an unimmunized child. Okay. So these are the Indian guidelines, guys. If it is less than 7 years. So very quickly, so how I like to remember is if you have an unimmunized child, at the first visit, you give the birth doses, all three birth doses, which is OPV, BCG, Hep B. Followed by that, you will also give DTaP. Preferably, you will give DTaP. Fine. After 1 month, BCG anyway, you give only once normally also. So remove off BCG. You give OPV, you give DPT, you give Hep B. Then again, after 2 months, you will give OPV again, but you will now give measles containing vaccine. Okay, one more important thing. What is this measles containing vaccine, guys? What is that measles containing vaccine that we give? Is it MMR or is it MR? What is that thing that you give here? Is it MMR or is it MR? MR. Excellent, excellent. So initially it was MMR, but now they have removed mumps from it, and the whatever is the recent schedule that you have is just MR, which is measles and rubella, right? Very quickly, what is measles, guys? What is measles? Can anybody, what is the typical rash in measles? Can anybody define what are the clinical features that you see in measles? Just a quick micro D route. Yes, maculopapular rash. What, how do you define a measles rash exactly? What are Koplik spots? I see a lot of Koplik spots in the answer. What are Koplik spots? Is it the rash? Is it, yeah, exactly. Yeah. So those spots are something that you see against the central incisors, right? Those are your Koplik spots. Whereas your maculopapular, excellent, 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 Dr. Chet. So whereas your macular papular rash, usually on day 4 of fever, guys, on day 4, day 5 of fever, you will have maculopapular rash, which begins behind your ear. Is it centripetal or is it centrifugal, guys? What sort of a rash is it? Centripetal or centrifugal? Yeah, this is very basic, guys. Is it centripetal or centrifugal? Anyone? What sort of a rash is the measles rash? Okay, first of all, what is centripetal? What is centrifugal? Define centripetal and centrifugal for me, guys. So centrifugal is rash which begins on the center and then spreads to the extremities, right? It's spreading away. So your measles rash that you have is typically centrifugal rash. Okay, it is centrifugal rash. Okay, so this was what I was talking about, the national immunization schedule, which is your unimmunized child. Okay, so very quickly, I'll talk you through the Australian guidelines as well. So I am assuming, this is kind of a little memory heavy topic, guys. So yes, there are a lot of differences between the national immunization schedule and there are differences between the Australian guidelines. So very quickly, I'm sure, this is not something that you want to remember at this point, but just very quickly, let's just at least see the differences, right? It's a little memory heavy. Let's just see the differences and, let's just go quickly through it because there's not much to be understood. It's more of a core memory topic. Fine. So in India, what are we giving at birth, guys? In India, what are we giving at birth? We're giving OPV, we're giving BCG and Hep B, whereas there you only give Hep B, right? Because usually, what you say, TB is something which is more common at our place, right? So that is what we're giving at birth. Then you have something called as, in India, you have 6, 10, and 14, whereas the here you have what we call it as 2 months, 4 months, and 6 months. Fine. 2 months is roughly around 8 weeks, right? 4 months is 16 weeks for you, whereas 8 months will be 24 weeks, right? So even the duration or the time at which we give these vaccines are also different if you see in the Australian guidelines, right? So we have something called as 6, 10, and 14, whereas here you have 8, 16, and 24. Guys, very quickly, let's just, I don't want you guys to, remember all of this at the go, but just look at these and tell me, are like, is it the same vaccines that we're pretty much covering, or there any additional vaccines that we're also covering here? Yeah. Anyone, just tell me what are the differences at this point? Because it's difficult for you to remember all of this at a stretch. Excellent, excellent. Meningococcal. Do we give meningococcal as a part of the national immunization program, guys? Do we give meningococcal as a part of the national immunization schedule? Anyone? No. So this is one major difference that you can actually pick out, that actually in the Australian guidelines, which we are giving meningococcal, right? Excellent, guys. Excellent, excellent. So you have picked out what is the difference. I'm sure if you remember, I just want to I just want you guys to pick up those major differences that we can see here. Excellent, guys. So you have picked up that we do not give meningococcal. And what is that things that we cover in national immunization schedule, which is not here? Very quickly. Anyone? What is it that we cover in national immunization schedule, but it's actually not mentioned here? BCG, OPV, IPV. Guys, polio is covered here, guys. MR, excellent. That was actually the answer that I was looking for. MR. Anything else in our immunization schedule you give along with MR, which is also not here? Anything else? Typhoid. Okay, doctor, typhoid is actually a part of IAP, right? It's not a part of your national immunization schedule. Perfect, Aruna. The thing that I was looking for was JE. Excellent, guys. Excellent, 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 excellent. And another important thing, if you can actually see in their immunization schedule, they have also included influenza, guys. So influenza is a part of the Australian immunization schedule. Is it a part of the Indian immunization schedule, guys? Does the national immunization schedule recommend you to get influenza vaccines? Is it a part of no, right? So these are all additional vaccines which are available commercially, but they're not a part of the national immunization vaccines, right? So this was just a quick deroute or a quick takeover, because I am pretty sure even if I read out those vaccine names, I don't think it'll help you much in remembering. I just wanted to point out what were the major differences between both the countries, because India is endemic to TB. We have a BCG vaccine which is completely missing from the Australian guidelines, right? And some things which we have, which is MR and JE, again, they don't have it. Whereas something that they are covering very frequently is meningococcal vaccine, which we don't have in our schedule. I just wanted to highlight a few differences between our schedule and their schedule, right? And again, there's another beautiful table about the catch-up vaccination, guys. Again, I don't want to go in detail about all of these things because they're very different. And, whatever time frame that we have, it's kind of short to, remember and go through this. But on the longer sessions, I'm pretty sure we'll make interesting mnemonics. We'll make some or the other ways to remember the immunization schedule. Fine. So I think that is from my end. In case you want some help, I can help you with some mnemonics with the national immunization schedule. Does anybody want that, or no, it's done for the day? Like, yeah. And does anybody want a very yeah, you want a mnemonic for national immunization schedule? Fine. So this is a very nerdy mnemonic. Okay. Don't yell at me like, ma'am, kya hai abhi? Okay. So everybody remembers birth dose, guys. No mnemonic for that. It is BCG, OPV, and HBV. But still, if you can't remember this because you have very poor memory, then I'm a Harry Potter fan. So I watch Harry Potter on HBO. Okay. So this is the mnemonic at birth dose. We are all Harry Potter fans. We're watching Harry Potter as a HBO series. So this is hepatitis B virus, BCG, and OPV. This is the birth dose. This is what you're going to remember. Okay. Then coming to 6 weeks, 10 weeks, and 14 weeks. Okay. So we are doing pediatrics. Remember ROP. What is ROP? If you don't know, I'm telling you, these are very nerdy mnemonics that I've made. Don't yell at me. ROP means retinopathy of prematurity. It is a very serious condition. You are treating it on IP basis. Okay, remember this way. ROP is a very serious condition. You're admitting the patient and treating on IP basis. Now I'll tell you how this is useful. Actually, Snigdha ma'am was also asking you, right? What is the difference in your 6, 10, and 14 immunization schedule, right? So now you're going to tell, ma'am, I got you. We're not missing this one. ROP, you're writing for everything, guys. But on 6 and 14, you're only writing IP. Very quickly, tell me now what are the full forms of this? You're not missing out the full forms, guys. You make mnemonics, miss out on the full forms. Can anybody elaborate what this is? Very quickly, guys. So R stands for what, guys? R stands for rota, perfect. O stands for OPV, perfect. P stands for pentavalent, right? So what is this pentavalent? Very quickly, can anybody tell me what are the components of the pentavalent, guys? That is something again we miss out on. Everybody is like penta, penta, penta. But what are those components of penta? Guys, this is very serious, huh? You're not able to answer. Matlab, something is brutally wrong. Okay, okay. I see answers here. Perfect, perfect, guys. Perfect, perfect. Okay, okay, okay. Excellent. Okay, so you have rota, you have OPV, you have penta. Now IP. This is why I want you to remember this mnemonic that way, that you treat ROP on an IP basis, because in 6 and 14 you have IP, whereas in 10th week vaccination you do not have IP. This is a better way of remembering it. So what is this INT, guys? Anyone? Very quickly, what is this INT? Yeah. So I is IPV and P is PCV. Excellent, guys. So this is 6, 10, and 14. Then very quickly, you have 9 months and you have 6 to 18 months. So I'm sure we've already discussed all this. Again, this doesn't need a mnemonic. It is MR, vitamin A, and you are giving JE Again, here also you will do the same thing. MR2, MR1, you have vitamin A and you have JE2. Just you have a few booster doses that I want you guys to remember here. Here you have PCV3, guys. Okay, here you have PCV3, whereas here you have OPV booster. And you also have DTWP booster. Okay, so these are the two, you can remember these two. That's it. These are the only things that you have to, even if you want a mnemonic here also, what you remember is, so you have only written IP here, you have written it only twice, right? Whereas you have written ROP thrice, so just get the P down. Okay, that's just an easy mnemonic, or you've just mentioned PCV twice, so you get it down. You give a third dose again. Okay, and then you give the ROP may the next thing you give OPV and you give DTP boosters here. Fine. This is just one mnemonic that you can remember. So just remember, I'm a Harry Potter fan. I watch HBO series at birth, and then I'm treating ROP on an IP basis. This will sort out your vaccination schedule. Okay, you're never ever getting any of these. What vaccine is to be given at what age, right? Slightly nerdy mnemonic, but I think you should be able to remember it. Yeah. Thank you, guys. Thank you for listening. Thank you for joining in. I hope I didn't bore you a lot. I hope, you were able to take away a few points. And I hope, whenever now, next time you have any niece coming to you with those growth charts or vaccination schedule, you're like, hey, I'm smart. I got you here. Fine. Thanks a lot, guys. Thanks a lot for hearing. Thank you.
Thank you so much, Dr. Bhavya. That was such an informative session. Like I could remember just everything coming back to me. If I
Thank you.
could
Thank you,
just
doctor.
present, if I could just present the PPT now for the
Yeah.
masterclass.
Yes, sure, sure. I'll just stop sharing my screen and you can take it from here. Yeah, done.
Thank
Thank
you.
you.
So, guys, I will be continuing this masterclass just with a short presentation for you all. And then we'll continue with a small question and answer session with Dr. Bhavya. If you have anything from the growth charts and uh, the vaccination schedule, if not, then we'll further continue with AMC based questions. So, as you can see, we just finished the last part of the vaccination schedule. Now we have a few offer candidates that you can see who cleared AMC exam with us. And these are just a few names. We have a lot of students coming every month qualifying AMC exams with amazing marks. I mean, 250 is just a qualifying requirement, but a lot of them are scoring way high, somewhere around 300 as well. So we are just not an ed tech that makes you pay. We also give scholarships. So what do you need to do to get the scholarship? You go to our website, take the test, and get the scholarship based on your scores. You can see our reviews by the students who have passed with us, Dr. Ragasri, Dr. Sanjana, Dr. Raghu, and a lot more. You just have to go to Google, type academically, and click on reviews. You can see all of them. But then again, the question comes, why us? Now, academically, we have a very big alumni network. Even if you pass AMC 1, you're still connected with us like a family. And we try and guide you to the end. We give you a personalized approach. We have a high quality content. You have seen Dr. Bhavya. She is taking pediatrics for us, for you guys. All our faculty is amazing. We have a reputation and our success rate is more than 90%. Now, if you want to visit academically, we have an office in Dehradun. We have a new office in Hyderabad. And we also have an office in Australia. So whichever place you're comfortable, please visit us. We have a lot of media coverage, which you might have seen lately. And if any one of you follows the news, we were featured on Outlook, Hindustan Times, Economic Times, Times of India, and many more. So guys, please find us on Google, review us, and you can also contact us. Please find these numbers or the email ID, and you can contact us, and we will guide you through the pathway for AMC. Now, I will stop sharing my PPT. So guys, you can raise your hands, and we will take questions. First, initially, I would like to take questions if any are there for Dr. Bhavya. Any questions regarding pediatrics? Guys, please. Yes, I can see Dr. Sandhya. Please unmute yourself.
Ma'am, am I audible?
Yes.
Yes, Sandhya, please go ahead.
Ma'am, I want to know, like I'm preparing for AMC. I also have a degree in pediatrics. I would like to know if at all after passing AMC, what would be the good places to apply? I don't know if this question is applicable now, but know how to apply and which places would be good to apply for pediatrics.
Dr. Bhavya, should I take this one?
Yes, please, Dr. Sandhya.
Okay. So, Dr. Sandhya, actually, how long has it been that you passed your MD?
It was around 2 years ago.
Okay, so we can say you have 5 years of experience. They count 3 years of MD and 2 years after your MD. So there is a specialist pathway. You can try going through it, but there are always chances of getting a rejection. Okay, we have Dr. Priyanka, who's a faculty. She has an experience of 10 years, but she didn't want to take that risk. And she went through AMC 1, and further on, she's now working there as a registrar in gynecology. So I would say you can give it a try. We will have one of our counselors get in touch with you. Can I have someone to get in touch with Dr. Sandhya
Sure,
and
sure,
guide?
sure, sure. Sure.
Okay, thank you, Arinda.
My members are
For
here.
this. Okay. So, Dr. Sandhya, someone will get in touch with you and explain you the specialist pathway. Okay?
Yeah, thank you, ma'am.
Okay, thank you.
Thank you.
Guys, can we have questions for Dr. Bhavya, please, regarding the course, specifically pediatrics? I will answer all your AMC related queries, but any queries for pediatrics? Come on, guys. ज़्यादा पढ़ाई तो नहीं होगी. Okay. I think, Dr. Bhavya, most of them are more curious about the AMC pathway.
Yes, yes, please.
And thank you for taking this amazing session and being here for this masterclass. I learned a lot from this class. Your mnemonic is amazing. I'm a Harry Potter fan and I'm never going to forget it.
Thank you. Thank you, Dr. Snigdha. Thank you for giving me this opportunity and
Thank
this
you, Dr.
platform.
Bhavya.
Hi, Dr. Akram, sir. Hi.
Thank you.
Thank you.
Thanks a
Have a
lot,
good
sir.
evening, Dr. Bhavya.
Thank you, Doctor.
Okay, guys, please raise your hand one by one and we start taking your queries regarding AMC. Okay, Dr. Siddharth, please unmute yourself. I see now everyone has a question. No one wanted to study. I get the point now.
Hello.
Yes, Dr. Siddharth,
Yeah,
please.
Dr. Snigdha, very good evening. I just have two questions over here. I am chasing this course from very long and I just tried to register once again through the website, but I don't know what is the reason I'm not getting the direct course registration. So can you please share me the link along with how much is the fees for this course?
I would do better. I would get a counselor to get in touch with you immediately. They will give you every information that you need. Arindam, can we have someone to get in touch with him immediately?
Because
Yes, I will
few
connect, yeah.
months back also I already had a discussion with Dr. Akram once too. A very good
Okay.
evening, sir.
Good
And
evening.
I'm just trying to get into this course from like last 2-3 months, but
Okay,
because
I'm
of
so
my busy
sorry.
schedule.
Arindam, are you there? Arindam Abbas? Is there anyone from AMC counselor है कोई यहाँ पे? Please connect कर लो Dr. Siddharth.
And second question is how to download the certificate for this session.
Yeah, they will also help you in that.
First, can you repost the link to download the participation certificate in the chat, please?
Yes.
Okay, thank you, Faiz. So he'll be shortly posting the link in the chat box. You can get your participation certificate from there. And Dr. Siddharth, I am writing down your name. Here's my pen and
Thank you.
here's my notebook. And if
Thank
no
you.
one, I'll personally get my program manager to get in touch with you. Okay?
Thank you very much.
Thank you. Have a good evening. So who's next? Can we have Dr. Chetu? Can you please unmute yourself?
Hello, ma'am. Good evening, ma'am.
Good evening.
Ma'am, now raising concerns over the immigration issue in Australia, will it worth? Is it worth, ma'am?
See,
Yes, 100%. I mean, ऐसा कोई issue नहीं है. Generally, I'm living, in Australia last many years. There's no such discrimination. But I, it's some sort of like the politics, right? इंडिया में कोई ना कोई प्रोटेस्ट करते रहता है दिल्ली के अंदर, राइट? कभी ये पार्टी आई, कभी ये पार्टी में, तो थोड़ा सा वही है, आफ्टर सम टाइम, ऐसा कुछ वो इतना इशू है नहीं वहाँ. ऑस्ट्रेलिया इज अ वेरी सेफ कंट्री. यू कैन nothing about Australia. You can see it right now, even in UK, Germany, US, बहुत सारी कंट्रीज में चल रहा है, तो दिस इज नॉट जस्ट द ऑस्ट्रेलिया. बट ऑस्ट्रेलिया, आई कैन से ऐसा कोई भी प्रॉब्लम नहीं है. एंड दे नीड लॉट ऑफ डॉक्टर्स, स्पेशली इन द रीजन रिमोट एरियाज में.
Okay, sir. Thank you, sir. Sir, is it better to join after MBBS or after MD, sir?
After MBBS, after MD also same path you need to go. There's no advantage.
Okay, sir.
अगर किसी को ऑस्ट्रेलिया जाना है तो प्लीज ट्राई ASAP आफ्टर योर MBBS. ठीक है, दिस विल बी द बेस्ट थिंग. अदरवाइज 3 साल के बाद भी आप फिर सेम पाथवे पे ही जाओगे.
Yes, sir.
thank
Thank
you.
you so much.
Thank you. So next we have Dr. Swati.
Hello, ma'am. Is it audible?
Yes, it is audible, please.
It was a nice session, though. I am an MBBS graduate with around 3.5, 4 years of experience around. So I just wanted to know, like, if I have to apply for the AMC. I have gone through the website, and it's like, but I couldn't find my college in the world's directory. That standard of hospital.
WDOMS.
Yes, World
Okay.
Directory of Medical Schools. So, what is the is it very much necessary to have the list of college in that, or is there any?
It is important to have the name of your college in the directory. Can you please tell me what is the name of your college?
Yes, it is Shri B.M. Patil Medical College, Bijapur, Karnataka.
इट इज न्यू मेडिकल कॉलेज. और कितने बैच निकल चुके हैं यहाँ से?
Sorry?
I mean, it is a new college. How many batch MBBS graduate from this college?
It's not a new college, sir. It's like an old college, but it's a deemed university.
Okay, perfect. I mean, your university need to connect to them, and they will add. There is some certain criteria for them. Yeah.
Okay. So,
what?
But without if your name is not there, so we cannot help. I mean, no one can help basically, because now university need to connect to them to to add the university name in there. They will ask some document, all those things like NMC accreditation, all those things. Then they will
yes.
add. Yeah.
So nothing could be done from matlab
No.
student side. Yeah.
Not student side, never our side. Because university only or NMC.
Okay, sir. So, since this webinar is also mentioned about the Gulf exams, so what about those? Like,
If you have at least, yes, there you can go. Like in some country, like Saudi Arabia, no experience required, or for example, UAE required 2-year experience. So you can go there. Please wait. Our team will get in touch with you, so they will guide you regarding these Gulf countries.
Yes, sure, sir. It would be a great help, if I could find someone to guide around these exams, overseas countries. So, yeah.
Yes. Just please wait. Today or tomorrow, someone will connect you.
So, Dr. Swati, they actually have an entrance exam, and we are launching our own Gulf medical exam portrait, something similar to what we are doing for AMC. We are, and we have a few enrollments in it the course as well. So that could be a possibility for you. So, and for everyone else, if AMC is an option, but also Gulf courses. We are launching our Gulf course, guys. So if you think the pathway to AMC is longer for you guys, please connect to us for the Gulf medical course. Okay? And we will guide you and we will start the course with you. Okay,
Good
Dr.
evening,
Swati
ma'am.
will get counselor to
Yes.
connect with you. Okay?
Thank you. Thank you so much.
Good
Dr.
evening,
Bhavya.
Shikha, ma'am. Yeah.
Good evening.
Actually, I have two questions.
Mhm.
So, one question is actually in many, like, I wanted to join for AMC preparation from
Mhm.
academically.
Okay.
But some social media or some platforms, they are saying like academically they are actually giving a good course, but they don't guide much after clearing the exams. So what's your note on this? Because there are many other people who are like in other Telegram, they are actually spreading this news that so after part 2 clearance, so they'll be telling like it is they are busy in Australia, something like that. So there is a delayed communication gap between the the doctors and from your side. That is one question. And
Mhm.
let me ask second question also so that I can note. Second question is I want to plan for USMLE, but
Mhm.
unfortunately because of some reasons I'm searching for AMC pathways from the last 6 months.
Mhm.
So if I put my aim as AMC goal, is it worthy, or how many years it will take to get a job there after clearing the exams, and how much difficult getting a visa after part 1? And these are two questions from my
Okay.
side.
Thank you, Dr. Pawan. I will start with the
Yeah.
first one.
Yes.
We are giving coaching for AMC 1 and AMC 2 as well. Most of our
Yeah.
students are actually connected with us through our alumni groups. And we are still in touch with the first students like Dr. Ragasri, who cleared long back, and we still know what they are doing there in Australia.
Okay.
Immediately after you qualify your AMC 1, we have our qualified faculties, Dr. Swapnil, Dr. Naeem, a lot of them who are working in Australia. They take immediately a session within 1 week of you clearing the exam, guiding you how to make your CV, where to apply, when to apply, how to apply. They tell you everything in that session. Thing is how to update your CV. We as Indians,
Hmm.
we have a different format of CV compared to what the Australians expect. And
Yes,
what
ma'am.
we say, when you see someone, the shoe is the first thing you see, and that makes an impression.
Yes, ma'am.
Similarly, when you are not present in front of a person, your CV is the first impression, right? So
Yes, ma'am.
our faculties specialize and they guide you properly on how to develop your CV in a way that whosoever looks at it, the employer, basically, they are impressed by it. And what are the points that you need to keep in mind while applying? So please be assured that we do hold your hands till you
Okay.
qualify. Okay. Now, second part, when you're talking about the pathway, USMLE is a bit longer compared to AMC, what I have seen. But with AMC, it's how fast you are giving the exam and how fast you're getting the slots. It's not about clearing the exam, it's about the slots,
Okay.
especially with AMC2. AMC1, it's very easy to get the slots. With AMC2, I have seen people struggling a bit to get the slot, but they usually get it within the 6 month period.
Oh.
Okay.
Is
So
it difficult getting a visa, ma'am, to clear that?
no. It's everyone easily gets a visa. That's not
Okay,
an
ma'am.
issue. And even if you are going to go settle there, the
Okay.
usual webinars which we do, if you would see, there's a huge demand for doctors there, and they're easily giving the PR visas to doctors. So there's nothing to worry about that we won't get the visa if we want to go there. We won't be able to take our families. Rest be assured, that's not an issue.
Okay. Can we give ANC part 1 during internship, ma'am? So is it possible, because we'll be getting temporary
No,
ID actually from the university. I
I
heard
know.
from many things. Yeah, no?
No, you need your degree for the registration.
Okay.
But it's better to start your preparation during internship.
Okay. Okay.
Why? I will tell you. So most of
Okay.
the AMC exam are clinical subject, right? And while
Yes,
you're
ma'am.
doing your clinical postings, the question format is clinical based. There are clinical scenarios there in exam. So while you're
Okay.
reading the subject, suppose you are doing gynae, right? Gynae rotation, and you're doing women's health in AMC, you will be able to correlate the text to the patients that you're seeing. And the memory formation that happens when you see a patient and correlate a text, that is the best memory and the best recall you can have during an exam.
Yeah, yeah.
There is nothing
Yeah, ma'am.
beating the recall of when you have touched the patient for this case. So
Okay.
I would say start your preparation while in internship, and the moment you have your degree, just give the exam.
Okay, ma'am. Thank you so
Okay,
much. Thank
okay,
you, ma'am.
most welcome.
Hello,
Hello.
hello, ma'am.
Hi, good evening, Dr. Harshal.
Very good evening, ma'am. I'm just graduated 3 years before, 3 months before. I just got my
Mm-hmm.
degree, MBBS.
Mm-hmm.
So is it worth to prepare for MC now?
Yes, best time.
Oh,
You're
okay.
just fresh pass out. Instead of wasting time looking for options here and there, keep working. Don't
Mhm.
leave your practice wherever you're working, even 4 5 hours. Start with your AMC preparation. Probably in 6 months' time, you would just give the exam, qualify it, and then start with the AMC two. By next year, this time, you might just be qualified with the AMC two as well.
Okay, and how can I join the classes for MC with
Okay,
academically?
we'll have a counselor get in touch with you
Okay,
today or by tomorrow, and then you can start the classes with us. Guys, we have a new batch for our AMC course starting on 14th of October. So all
okay,
of you who want to start with us, please join this batch. 14th of October, we are targeting to finish the course, at least just the theory by Jan, so that you can target April, May, or June sessions. Okay? So
Yeah,
most
okay,
of you,
yeah. One thing I want to add here, the earlier candidate was asking regarding the jobs. I am the CEO of Academically, and this is my personal, yeah, WhatsApp. But you can see here, this is the company we signed MOU with Australian company. We are helping our student to get a RMO job in Australia. Okay, and we are not charging a single rupees for this. We are charging you only for our course only, right? And we are helping to you to land a job. And in last batch, there's a 28 students graduate from academically AMC one, and out of them, 18 students already got the call for interview for first round. You know, so there is so many students. We help them to, it's not just we are here to help you to pass the exam, but we'll also help you, whatever we can after you. So we also want if you can, land a job, definitely is a positive story for us, right? जितने बच्चे हमारे पास करते हैं from academically, we help them in their CV, in their cover letter, how to apply, और upcoming कौन सा state में होने वाला है, so you can prepare accordingly. And we have a partner in Australia. They will help you to land a job in Australia. It's not in the government sector, wherever job, in private, government, everywhere they are helping to all the students. तो if I take 28 में अगर 18 बच्चों को मिल गया तो you can see ये कितना high percentage है. Obviously they are giving the preference those have at least 2 year experience after your MBBS, right? तो जितनी ज्यादा experience है, there is a high chance to get a job. Yes, Dr. Singh, can you please?
yes. So thank you, Dr. Akram, for the clarification. Dr. Pavan, I hope you are here and you have seen. See, we can only do the work behind the scenes, behind the curtains. We cannot handle what our competitors or what the people will criticize. That is how the world works. At the end of the day, we have to put in the hard work and we have to do what we can do best for you. So we are doing it, but we can only do enough to just control it. Rest is just luck, I guess. So, guys, anyone else? Guys, any questions for us today? I
uh,
guess you all are
yes,
joining.
ma'am.
Yes, Dr.
One
Harshal.
question. How will be the classes, like in live or recorded videos?
So we have both kind of courses. It depends on you.
Okay.
Which one do you prefer? I would personally say join live classes. It keeps you on your toes because you want to come and attend the class while the teacher is teaching, and because you can ask your questions there and then during the class. So it's always a better method of delivery, especially because sometimes a lot of people have a huge gap between their studies and the work and everything. So if not, but some people say we are unable to do the live lectures, so they go for crash course. But my personal opinion, I would always go for live classes. But you can choose. Okay.
Okay,
We
ma'am.
have Dr. Shoaib who has raised his hand. Please go ahead, Dr. Shoaib. Hello. Hello, Dr. Shoaib. Guys, please raise your hand because I'm calling your names depending on the queue that I get. Okay. Now I have Dr. Pavan again.
Hello.
Yes, Dr. Pavan.
Yeah, I just want to know that you have any idea about my branch, that is a biochemistry branch, MD Biochemistry. Any opportunity at UAE, Gulf countries,
In Gulf countries.
Gulf, yeah, especially Gulf.
So the thing is, if you've already done MD biochemistry, you will follow a different pathway.
Yeah,
There's a
okay,
separate
specialist.
specialist exam.
Yeah, yeah.
See, they are welcoming all kind of branches easily there with open hands. So if you want to go, depending on which country you want to go, you'll have to do your exam.
Means, is there any courses or is there any pathway you have for this
We
specific
don't
branch?
we don't have courses like specifically to the branches. So sorry for that.
Oh, okay, 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 okay. That's okay. Thank you.
I see Dr. Jaya.
Hello.
Hi.
Uh, Good evening, ma'am.
Good evening.
Am I audible?
Yeah. Please go ahead.
Yeah, ma'am. I want to know about do you guys have any pathways for UAE? Since I
Uh,
have done, I have done my MBBS from Ukraine, so I'm
mhm,
looking for like joining an internship and then like planning for my PG in Dubai as well. So, do you
mhm.
guys have any idea regarding that one?
Yes, Dr. Jaya, I will get one of our counselors who's present here to connect with you either today or by end of the working day tomorrow. We
That.
have, we have,
You work on Sundays as well?
sorry.
You work on Sundays as well?
Yes, yes,
Uh,
we do.
yes,
Okay.
yes,
Okay.
yes. So that's
Okay.
why I said that either by today evening or by tomorrow. Okay. So
Uh.
we have a Gulf course. I'm
Okay.
explaining before. Okay, we have a Gulf course for medical students, specifically for all the Gulf countries. Depending now, your eligibility depends on how much work experience you have. There are Gulf countries which don't need any experience, but then there are few which need experience.
Mm-hmm.
So whatever your criteria will fit you, you can enroll in the course. We will have live sessions, and then you can prepare for the exam and go ahead with it.
Okay, ma'am. I want to ask you about regarding the internship as well because like, I have seen Dubai has announced an unified internship programs for foreign graduates for the people who have not done their internships after completing their MBBS. So, in case of if we are joining the internship, we won't be requiring 2 years of experience because since we are a fresher, so after
Mhm.
just completing the internship, you can give the DHA directly. So, do you guys have any idea regarding this one?
So, Dr. Jay, see, now you are a graduate from Ukraine, as if I'm not right. So
Yeah.
now, if it was a 6-year course,
Yeah, it was 6 year course.
so even if you don't have an internship separately, but it's still considered a complete course when it's 6 years.
Okay.
Okay, so because there are different degrees with different duration, so there are different clauses. Your degree is a complete one.
Uh-huh.
You need an internship for suppose you give it in India, it is only as a necessary documentation criteria that you need to do your internship.
Okay.
Not necessarily that you'll have to do the same for UAE, because even though it's a 6-year course without internship, you are doing your rotations.
Uh-huh.
So in the 4 years of clinical rotations, this few hours that you're going to the clinics every day, you are completing the criteria of clinical rotation that is necessary to be calculated as an internship.
So we don't need a separate internship if we have, if my course has been like for 6 years.
Yes,
Oh,
that is the criteria. Okay. But still, I would tell you to just connect with a counselor, send your documents. Let us just verify that once. Okay.
Yeah, sure. We can do it.
Okay, Dr. Jay. So I expect to hear from you in my Gulf course by next week. Okay.
Yeah, I'm happy to. I'm glad to join.
Okay. Then let's start.
Yeah, because like I have I got this link from one of your consultants. From the WhatsApp. Like, can I just connect them through the WhatsApp directly?
Sure. Go ahead. Do that. They'll give you all the necessary information. And
it's Partha from your academy.
Okay, the counselor's name.
Our counselor. Yes.
Okay.
Okay. So should I just text him regarding this one? So you'll be sending the link directly to the one.
If you can just connect with her on WhatsApp, please.
Oh yeah, sure. So today or tomorrow evening.
Yes.
Okay. Thank you. Thanks a lot.
Okay. Next we have Dr. Saklain Mohammed.
Oh, good evening, ma'am.
Good evening.
Ma'am, as Sir has told that for Saudi, no need of experience. Ma'am, but I have seen in various platforms that it has been mentioning mandatory of 1 year of experience. Could you clarify regarding it?
See, in a lot of platforms, they all give a different information. The only short information that don't go on platforms, go on their official website.
Okay.
Whatever the information is written there, please go with it.
Okay, I have completed my graduation 6 months back, and I'm planning to write a SMLE exam. As Dr. Akram has told that there is no need of experience. After clearing SMLE, should I need, for applying the jobs, should I need any experience at that time?
Now, my question is, why, if you want to work in Gulf, why are you spending time giving your USMLE? Like, do you want to work? Like, how do you want to plan your career further?
No, I am not planning for USMLE. I'm planning for SMLE, Saudi
sorry,
Medical
I'm so sorry. SMLE. Okay, sorry. I'm so sorry.
So, what is the question? Can you please repeat again?
As you said that there is no need of work experience for SMLE. After clearing SMLE, at the time of applying jobs in Saudi, should I need 1 year of experience at that time?
No, not required. But obviously, if you have experience, there's a high chance to land a job, right? To sit in the licensing exam, no work experience required. But जब आप job को apply करते हैं, आपका experience होगा, this is good for you, right?
Okay.
Yeah.
Why don't you do one thing? While you're preparing for the exam, keep working in a small hospital somewhere around 3 to 4 hours.
Yeah.
It will also help you in preparation, like
the
clinical.
Everyone, it is not for, please work and simultaneously you need to prepare for any of these exams, whether it is the AMC or any Gulf exam. बहुत सारे लोग क्या करते हैं इंडिया में, मतलब करियर बैक ले वर्क नहीं कर रहे हैं, just preparing for the exam. So this is
सर, बट वो तो फियर तो रहता सर, जैसा कि आप प्राइवेट में जॉब कर रहे तो वो वर्क आवर ज्यादा रहते, प्रिपरेशन पे ध्यान नहीं दे सकते, तो दिक्कत होती है ना.
बट बेसिकली क्या होता है कि recency of work employer will see recently आप वर्क कर रहे हो, क्लिनिकल प्रैक्टिस कर रहे हो, वेरी वेरी इंपॉर्टेंट, राइट? तो अगर आप 10 घंटे भी जॉब कर रहे हो, आई एम श्योर 10 घंटे ज्यादा कोई जॉब नहीं करता होगा मेडिकल में, तो अगर 10 घंटे तो भी still you can manage, because these course required 4 to 5 hours per day, per hours, and this is like for 4-month course. तो आप 5 घंटे पढ़ते हो is enough. It is not like a 12 hours, 15 hours you need to study.
तो अब अपन 6 months के अंदर कोर्स क्लियर करके एग्जाम भी क्लियर करें तो
within I am telling 4 months, 6 months, definitely you can, whether it is AMC or this Gulf country.
ओके, तो अपन क्लिनिक में करे तो भी वो 6 months का एक्सपीरियंस नहीं दे रहे सर, मिनिमम ऑफ 1 year ऑफ एक्सपीरियंस के बाद ही उन लोग एक्सपीरियंस प्रोवाइड कर रहे प्राइवेट क्लिनिक्स में.
You need to pass the exam, continuously start looking a job, right? अगर जॉब नहीं मिल रही है तो आप इंडिया में ही कंटिन्यू करो, 6 months और कंटिन्यू करो. और जब
Okay,
जॉब
okay,
मिलेगा जॉब मिले तभी तो आप सऊदी जाओगे, राइट?
okay,
आप कंटिन्यूअसली जॉब करते रहो इंडिया में और जॉब को अप्लाई करते रहो, जितना एक्सपीरियंस आपको बढ़ जाएगा आपके हाई चांस होंगे जॉब के।
ओके, बट वहाँ पे जॉब अप्लाई करने के लिए यहाँ का एक्सपीरियंस रहे तो भी चलता, नहीं रहे तो भी चलता
एक्सपीरियंस इज
होगा?
नॉट मैंडेटरी टू अप्लाई जॉब, बट अंडरस्टैंड, एक एम्प्लॉयर को 2 बंदों ने अप्लाई किया, एक 0
हाँ,
एक्सपीरियंस देखने किया, 2 साल एक्सपीरियंस, तो किसको पहले कॉल करेगा वो, राइट?
ओके, फाइन, थैंक यू सर, आई अंडरस्टूड।
मतलब वो एम्प्लॉयर को तो चाहिए थोड़ा एक्सपीरियंस वाला बंदा हो, जॉब को अप्लाई के लिए एक्सपीरियंस नहीं चाहिए, एग्जाम
तो
देने के
अपने
लिए एक्सपीरियंस
इंडियंस का
नहीं चाहिए।
तो इंडियंस का क्या है बोले तो मोस्टली 90% दे आर प्रिपेयरिंग फॉर नीट पीजी विदाउट डूइंग एनी जॉब, सो
Yes,
दे after getting disappointed with NEET PG rank, they'll plan for alternate option. Most
yes,
of the
yes.
people
हमारे
are
पास
like
बहुत
that
सारे
only.
बच्चे आते हैं नीट पीजी और एफएमजी वाले, जो 3 साल 5 साल प्रिपेयर किए और नहीं हुआ, फिर वो आते हैं अल्टरनेट ऑप्शन के लिए। तो वी सीन एवरीडे दिस काइंड ऑफ केसेस, सकलेन। दैट्स व्हाई मैंने बोला
तो
कि
उन
इट
लोगों
इज
का डर
नॉट
क्या
फॉर
रहता?
यू एवरीवन, तो प्लीज जॉब करो, क्या पार्ट टाइम ही करो, 5 आवर ही करो आप, क्या 3 डेज करो
ओके,
वीकली,
तो उन
बस।
लोगों का डर क्या रहता बोले तो नीट पीजी को लोग जॉब बिना जॉब करे ही उन लोगों को रैंक नहीं आया, तो अब जॉब करते हुए ये लाइसेंसिंग एग्जाम क्लियर कर सकते हैं या नहीं बोल के डर रहता ना बोल के, वो एक है सर, उतना ही, नथिंग एल्स।
यस, आपने एक गुड पॉइंट दिया, थैंक यू।
हाँ,
Okay, thank you, Dr. Saklian. We'll move
थैंक
on
यू
to the
मैम,
next student,
थैंक
Dr.
यू, ओके
Daniel.
मैम, थैंक यू सो मच।
Dr. Daniel, can you please unmute yourself?
Oh, am I audible, ma'am?
Yeah. Please go ahead.
Ma'am, is there any mock test for this coaching? For
Yes.
In the course module or separately?
Mock
in
test
the
to practice.
separately, is it
Yes.
available?
Yes, in the course content, we have subject-wise mocks, we have mixed mocks, and we even have the simulation of the actual AMC exam, 150 questions, timed for 3.5 hours.
Oh, thank you,
I
ma'am.
have shared a link in the chat box. You can go on this link. This is free AMC mock test you can attend here. Okay? Daniel, you can go to the link I've shared in the chat box, and you can attend this free AMC mock test.
Okay, sir. Thank you, sir.
Okay, thank you. Can we have Dr. Idara unmute yourself, please?
Yeah, good evening, ma'am.
Good evening.
I am a 4th-year medical student. I am about to graduate in this December. I'm just searching for the pathways which I could choose. I'm still skeptical about choosing Australia or New Zealand or continuing with India itself. Can someone guide me with the Australia and New Zealand exam? So, what is the process and what are the requirements to be done?
See,
And
yes, please.
I have a doubt that like some of my friends said it's a mandatory 1-year internship we need to do in the same college where we have studied our MBBS for Australia exam. Is it true, ma'am?
No, you just need 1 year of internship. It has going to Australia has nothing to do where you complete your internship till the time you get your degree and registration after you complete your 5.5 years. Number one. Number two, staying in India, again, it's a competitive exam. Dr. Akram has been mentioning that multiple times in his YouTube videos or all the counseling sessions. Unlike the competitive exam, NEET PG, AMC is just a qualifying exam, which means you don't need to score good. You just need to get a 250, qualify the exam, and that's it. So my choice would be Australia or New Zealand. Now, Australia or New Zealand. So the best thing is AMC 1 is acceptable both in New Zealand and Australia. So you do your AMC 1, which is the MCQ part, you clear it, you give your English proficiency exam, and once you're done with all of it, then you can decide if you want to stay in Australia or if you want to go to New Zealand. Depending on the choice, you can choose the next exam. If you plan to stay in Australia, you get AMC 2. If you plan to go to New Zealand, you can get NZREX, okay?
Okay.
You have enough time while giving AMC 1 and English proficiency exam to decide where you want to plan your future, Australia or New Zealand. But always India, if you want to struggle, sure, go for India. It's a home country. I wouldn't say anything bad about it, but there's a lot of struggle to secure. Even for a simple subject like community medicine, there's a lot of competition now,
Yeah, yes, ma'am.
right? So, yes, it's not easy.
And one more doubt is like now I'll be graduating and I'll go to India and I'll take my FMG, and then after 1 year internship, do I need to apply
Wait,
AMC
are you
or
are you an Indian medical graduate or are you a foreign medical graduate?
I'm a foreign medical graduate, ma'am?
You're a foreign medical graduate. Now, then again, a 4-year degree from which country?
It's from Davao, Philippines.
Okay. Arundel, are you there?
Ma'am?
No,
Yeah,
I'm just
yeah.
asking one of our counselors to get in touch with you to just make sure that the degree and the requirements, the internship requirements that are mentioned in your degree, they suffice with WDOMS.
Okay.
Okay. Yes. Now, please continue with your question.
Yeah, that's what my question is. I'm a foreign medical graduate. So what are the process and the steps that I need to do for the AMC or New Zealand?
It's the same. Once you get your degree and your registration, or even if not, just your degree has to be in your hand and the name of your college has to be in WDOMS. Okay, you can just Google it, check if your college name is there. If it is there, whenever you get your degree, you can start with the process for registering for AMC exam. But till then, while you're doing your internship, you can always start preparing for AMC exam if you want. And you can do your skill assessment when you get your degree. There's no harm in starting to prepare in advance.
Okay.
Okay? Okay. Good luck, Dr. Rao. So I'll move on to the next person. Dr. Jaya, we have already taken a question from you, so please be quick with your question.
Yeah, yes, ma'am. Am I audible now?
Yes, please.
Yeah, ma'am. Because like, I want to ask you one more question. Like you said, if we are doing like 6-year course, there won't be a mandatory internship required.
No, it is not necessary that you need it. See, it depends on the country to country requirement.
Yeah.
So India in general doesn't recognize the European degrees without an internship.
So what about we?
So that it depends on your country and your degree. If it is the number of rotations, hours that you have, if it recognizes it or not. But mostly it does. You have to first qualify the exam.
So DHA.
Yeah. Not DHA, whichever country you want to go to.
Actually, I'm planning for UAE countries.
Okay. Okay. So let the counselor.
You'll be the one who will be talking to tomorrow, like regarding this one?
No, I'm the academic head. You get to me when you enroll for the course. You'll be talking to one of our counselors. They will get in touch with you and guide with the process, and they will solve all your queries regarding which country you're eligible for, and you will share your degree with them, and they will confirm you before you enroll if you need an internship or not. All these technicalities about the countries, they will solve it for you.
Okay, ma'am. If in case of any internship needed, will you even guide me with that one?
Yes. Whatever is needed, we'll tell you the whole process. We won't enroll you unless we are sure that you are eligible for this exam.
Okay. So
Don't worry
in case
about
of
that.
any internship needed, you will be guiding me with how to get an internship as well, right?
How to get an internship in India or Dubai?
No, Dubai, in Gulf countries.
So we are yet to launch that path, but we are just helping with qualifying that exam for now.
So you are about to launch that path as well, maybe
Yes,
soon.
but we haven't done that, so I'm not going to promise you with something that we're going to do immediately. We will launch that path. It will take us some time. But
you are aware of the path one, right? You are aware. At least you are aware. Because like many agencies are not even aware of an internship program which has been launched by Dubai, like this unified internship program. So like working with someone who really knows it, at least have an idea, outline of it, like it's really helpful.
Yes, we have our lead faculty for Gulf courses. She's herself working in Saudi for now.
Like her name, ma'am. So at least I can.
No. Please, I won't do that. It's an open webinar for everyone. I'm sorry.
So okay, like I should ask Partha regarding this one.
Sorry.
So I should be talking with the guy who's like Partha, I
Yes,
guess.
yes, Partha. Yes, you should talk to him. Talk to
Yeah,
him on a personal channel. This is an
yeah.
open channel.
Okay, ma'am.
Okay.
I have spoke to him and he said he will connect with me as well.
Okay. Perfect.
Okay, ma'am.
Perfect.
Thank you.
Dr.
Thank you for
Okay.
it. Have a great
So
weekend.
okay, you too. I have Dr. ZI. There is no name. Sorry. Yes, please unmute yourself. Dr. Z. Okay. So yes, Dr. Z.
Hello.
Yes, please.
So, Dr. How are you doing?
I'm
I
good.
am a
How are you?
qualified graduate and
Sorry, your
actually
voice is
I
not that
want to
clear.
ask
Your
you
voice, Dr.
about the
V,
pathway.
Dr. V, your voice is not that clear. Can you go on a side and
Bluetooth off
just?
करो Bluetooth off करो Bluetooth off करो Hello.
Yes, it's much better. Thank you. Please.
क्या है भाई
Dr. V? Okay. Dr. Idara, you have already asked the question, so please have your next question quickly.
Ma'am, may I request if anyone could connect with me and guide
Yes.
in
Don't worry.
this?
We have already written down. I have already sent your information to a counselor. By end of working day tomorrow,
Yeah, okay.
you will get someone will see in front of you. I'm again writing it, okay? And someone
Yeah,
will
yes,
get
ma'am.
in touch with you. Please be assured.
Yeah. Yes, ma'am. Thank you
Okay.
so much.
Okay, most welcome. Yes, Dr. Sangeeta. One last question from Dr. Sangeeta, and we'll be winding up this masterclass for you guys. Yes, Dr. Sangeeta.
Ma'am, I have completed my MD Pediatrics in
Mm-hmm.
India.
Okay.
And now I'm currently planning to go overseas along with my family.
Mm-hmm.
So I'm actually in a dilemma between Australia and UAE. What would you suggest for I have in 2017, I had finished my MD Pediatrics and I have an experience of about 8 years post MD.
Dr. Sangeeta, you have a lot of experience, and I mean, we can almost count to 10 years considering your MD period. I would say personally, try for specialist pathway in Australia.
Okay, ma'am.
Because if you manage, I understand it might the processing fee and it might be a slower process. But if you manage, the prospects are amazing in Australia. And it's if it was me, I would prefer to go to Australia.
Okay.
And if it is a specialist pathway and considering a lot of consideration, you might just go without an exam. But if you plan to go to Middle East, you might have to give a specialist exam to qualify that exam. So, Dr.
Okay, ma'am.
Sangeeta, why don't I get a counselor to connect with you tomorrow?
Okay. Actually, I have spoken with Dr. Nitya.
Okay.
I had connected with her. Since it is a webinar, I just wanted to ask you in person.
Okay. So, but still, I will get one of our head counselors to connect with you tomorrow. And if any doubt, we can always get connected by the counselors.
Okay, ma'am. Sure. Thank
you. Okay.
And
So,
what about the AMC pathway? Should I undergo written exam? I mean, the MCQ exam and also some OSCE patterns?
That's what I'm saying, Dr. Sangeeta, because you have a lot of experience. Let's just once, it was MD or it was DCH?
I had 2 years of DCH and 2 years of MD, ma'am.
DNB, 2 years of DNB, right?
Ma'am, 2 years of DCH and 2 years of MD.
Okay. So we'll just have to verify that for the specialist pathway. We'll have to go through the documents once. And if you're eligible for specialist pathway, then it's a direct pathway. You won't have to give AMC. But like we had Dr. Priyanka, she was a DGO. She with 9 years of experience. She preferred to go through AMC 1.
Okay,
and then she went and she didn't give AMC 2. She didn't have to do that. She got a registrar job immediately after AMC 1 because of her experience.
Okay, okay,
So let us guide you with the pros and cons of the two different pathways, and let's see.
okay, okay, ma'am.
Okay?
Okay, thank
Okay,
you so
Dr.
much.
Sangeet. Okay. So I see Dr. Z has been trying to talk to us. Dr. Z, can we have a quick question, please?
Okay, doctor. Actually, I am a foreign medical graduate and I graduated in 2017. Can you hear me, please?
Yes, yes, I can hear you clearly. Please go ahead.
Hello?
I can hear you, Dr. Z.
Okay,
Please
I
go ahead.
graduated in 2017 and then I okay. Then I did 4 year postgraduate training in gynae and ops, and recently I have cleared OET twice. Now I am planning to move to Australia, and I really want to get some guidance about the pathway, because I have active OET, and I have yesterday I have completed my AMC portfolio, because I have already EPIC and ECFMG process completed. So can you please tell me that what should I do? Should I go for AMC part 1, or should I choose the specialist pathway, because I am stuck there?
Yes, so Dr. V, see, the problem with specialist pathway is they are usually asking for a higher number of experience years. You have a good number of like 4 years, but there's no harm in trying through specialist pathway first if it avoids giving an exam, I think. But like I just mentioned to Dr. Sangeeta,
But for the specialist,
mhm,
I just wanted to ask for the specialist pathway, what is the requirement? Actually, I have done my degree in my local country, and I have like part two MRCPI, part two written exam. Not I have not completed the clinical exam yet. So, should I still go for the specialist pathway, or should I complete my degrees
is your
first?
is your degree complete or not complete? Not completed, right?
Actually, it's clinical is due. Written is
Yeah.
cleared. Yeah.
Okay, so probably in a month or two you'll clear your written exam, right? Clinical
Yeah.
exams.
Hope so.
Yeah, you will. Don't worry about it. So whenever you do, then you complete your
Yes.
degree, and then only then you can go with specialist pathway, not before that. So if that is something you are still thinking about, then I would say start preparing
Uh,
for AMC one exam, clear your AMC one, and then you already have an active OET. It's better to go through AMC one question, like MCQ pathway.
yes.
Okay.
Okay, and can I get a job there after clearing AMC 1 and OET
Yes,
only
you can
without
try. You
AMC
can
2?
try. You can try.
Like, what are the chances for that?
I cannot just like it depends. See, there is a pool of hundreds or thousands of IMGs applying from all over the world, right? It depends how your CV is.
Okay,
Okay, so I cannot give you a chance. I cannot give you a number. I
okay,
might
but
just glorify it, and then you might have an
so,
issue
but
when you, yeah.
so is it still possible to get a job after clearing AMC 1 there? I just wanted to confirm
I
that.
just said yes.
Okay,
There is
and
a possible.
I also want to know that how to join your course for AMC 1, and what is the process for that?
So the process, we'll have a counselor get in touch with you. If you want to take a scholarship exam, you can go to a website, take
Okay.
the exam, and the counselor will guide you through the fees. And we have a new batch starting on 14th of October. You can just join it.
Okay.
Okay. I hope to see you
And
there.
how long your course been like? For how long?
You will get all
Okay.
the details through our counselor. It's an open channel. We prefer not to talk over here. Okay.
Okay. Okay. Okay. Okay. Okay.
Thank you. So we
Okay.
have
Okay. Sure.
one
Thank you
last
so much.
question.
Thank you. It was so helpful.
Most welcome. We have one last question coming from Dr. Chatan. Guys, we'll be closing our webinar after this. So if anything, please, Dr. Chatan, can you please unmute yourself?
Yeah, yes.
Yes, please. Go ahead.
Yeah, I completed my MBBS in 2022 in India. After that, I joined DN PG. I am right now in working in a government setup, government hospital. I want to go to AMC exam right now. Is it possible?
Did you just finish your MD?
No, I completed MBBS and I didn't do MD.
MD, you finished your MD in which year?
No, I didn't complete MD. I completed my graduation MBBS in
Okay.
2022.
Okay. So you have been working. There is no gap of work experience?
Yeah, I 2 years of experience.
Where have you been working?
I'm in working in a government hospital in India. Government setup.
Okay, so that's a very good. So you can qualify for the pesky pathway, but it needs 3 years. So I guess if you just add on here and there, it could just become 3 years by the time you start this process. That is one pathway you can go through for you. Okay. So you can try for pesky, or you can directly go through AMC 2 exam as well. Like that is, but start with your AMC 1.
Okay.
Okay.
Can I
with
get
your
the
AMC.
details about that?
Yes. So you have 2 pathways which can be preferred, 3 pathways, I can say, multiple pathways that you are eligible for just because you have a wonderful experience in a CV. You have to give your AMC1 English proficiency, and then you can decide on the pathway. We'll have one of our counselors get in touch with you by the end of working day tomorrow. Okay, Dr. Chakan?
Yeah, okay.
I hope to see you in our next batch starting on 14th of October for AMC1.
Okay. Thank you.
Okay.
I will be available.
Okay, have a good evening. Till later. So thank you everyone for this wonderful masterclass that you have all attended. You all will get a free certificate of participation, and I hope you enjoyed the wonderful session given by Dr. Bhavya regarding the growth charts and the immunization schedule, and that was a good revision for all of you. For the students who are planning to go to AMC, Australia or Gulf countries, we have courses beginning soon. So I hope to see you all in that course, both for AMC and Gulf. They're both starting in the second week of October. So hope to see you all there. Thank you for joining this webinar. Have a good evening and have a great weekend. Thank you all.